Hello, I'm Urologist Ömür Erdem Akkaya. We're going to make a short video presentation about thyroid hormone disorders and erectile dysfunction. Thyroid hormone disorders are seen commonly in people. Both its highness and lowness results in complaints of patients. In both conditions, we see failure in sexual functions and erectile dysfunction. The thyroid gland is a gland weighing approximately 20 to 30 grams just in front of our windpipes. But the hormone it produces has very important duties in the body. Thyroid hormone determines the biorhythm production of the body and determines to fasten and slow it. There's no place in the body that it doesn't have a role in, from hair, intestines, beating of the heart, immune resistance to the growth of the baby in its mother's belly, and intelligence development of children. It has functions in the body's all tissues and organs. As I said, deficiency or excess of thyroid hormone may result in erectile disorder. So, in 5 to 25% of patients with erectile disorder, thyroid hormone disorders have been observed. What are the complaints due to hypothyroidism? Reluctance, fatigue, depressive mood, loss of hair, inability to lose weight, and weight gain can be observed. In hyperthyroidism, complaints like palpitations, an increased heart rate, sweating, thinning hair, and weight loss can occur. Also, chronic diarrhea can be seen. But the interesting thing is, some patients may not have these complaints even though they are diagnosed with hyperthyroidism or hypothyroidism depending on laboratory tests. Then we call it subclinical thyroid hormone disorders. In this type, the patient is diagnosed with it but doesn't have a complaint. Also, in subclinical patients, if there's erectile dysfunction, when we cure him, we see that his erectile dysfunction and sexual function problems recover as well. The best thing about this subject is that thyroid hormone disorders are cured easily. And that outcome of recovery is pretty fast, and the patients recover so fast. So, patients with erectile dysfunction must also have their thyroid hormones checked. Also, there are some studies suggesting that hyperthyroidism is related to premature ejaculation. There are also some studies that if hyperthyroidism is cured, so is premature ejaculation. But some studies claim otherwise. Thank you for listening, best regards.